Now you can know the exact price you'll pay for your next car, so visit TrueCar to enjoy a more confident car buying experience. We are 10 minutes away from face-off in South Korea as the U.S. men's Olympic hockey team takes on the Olympic athletes from Russia. Team USA carries a 1-1 record into the matchup. Earlier Saturday, it was not Canada, it was Canada, as the Czech Republic broke Team Canada's 11-game Olympic men's ice hockey winning streak 3-2 for their first Olympic loss since 2010. NBA All-Star Weekend began with the Rising Stars Challenge. The world team defeated Team USA 155-124, but the real loser was apparently defense. I'm Isaac Lowenkron. Woo!
Good morning. I am Cynthia Tieche with the new radio talk show Coffee Talk with Dr. Tieche, which you can now listen in or watch on Facebook Live every Saturday morning at 7 a.m. This show is your opportunity to learn more about various medical treatments, procedures, alternative medicine practices, and really any other questions you may have for Dr. Tieche. He holds these talks at his clinic, Recharge Clinic in Ocala, Florida, about once a month, but we decided we could reach way more people if we went on the radio. So a lot of the topics that we end up talking about are hormones, erectile dysfunction, thyroid function, weight loss, medical marijuana, all sorts of topics, really anything that you want to talk about, but those are the ones we end up really talking about. Our phone lines are open. You can call, you can text, you can message us on Facebook with any questions that you might have. I do have some questions here that have been emailed into me this week that we will talk about shortly. A lot of the topics that I just mentioned will be some of those questions. So let's start off by introducing Dr. Tieche. He's been a medical doctor for over 30 years. He continues to broaden his knowledge in many different aspects of medicine. He understands medicine is not a one-size-fits-all. He really is researching all the time and learning better ways to help his patients. What we end up having is mainly patients are coming in who their doctors can't figure it out, don't know how to help them, and they're coming here, and Dr. Tieche usually figures it out. So, Dr. Tieche, I'll hand it over to you.
Good morning. I'm Dr. Steve Tieche. I wanted to give you a little bio on myself. I am what's called a functional medicine doctor, and that's kind of a newer specialty in medicine, functional medicine. And really what that entails is doctors who try to improve the quality of one's life. Most of medicine up until this point has been focused on improving outcomes with high blood pressure, preventing strokes, preventing cancer, things like that. But so people are living a lot longer, but the quality of some of those people's lives has not really improved. People are very tired, fatigued, have no energy, are overweight. So functional medicine doctors work in conjunction with traditional medicine, but try to optimize people's health and well-being. I grew up in Ocala. I went to high school here. I went to Vanguard High School. Then I went to the University of Florida as an undergraduate, and then University of South Florida College of Medicine, where I got my degree, and I did my residency down there as well. I was originally an anesthesiologist, and I practiced anesthesia for about 30 years, and over the past 10 years have been transitioning myself into functional medicine. I became interested in functional medicine really on a personal note because I was one of one of my own patients to an extent. I would go to traditional doctors with the common complaints that I hear almost every day. Fatigue, no energy, difficulty losing weight, and when I would have batteries of labs done, I was told that they were all normal, and that was basically it. Take some vitamins. So I realized and found out after I did find a functional medicine doctor that there was a lot more I could do to improve the quality of my life. And so with hormone optimization, vitamin supplements, exercise, dietary stuff. So I then really pursued that on my own and wanted to make that my next career, which that has been now. I now do this full time, and I practice here in Ocala at Recharge Clinic on 17th Street. And so that's a little about myself.
Okay, great. So we can go ahead and dive right into the juicy stuff if you want. I do have a question that, I have several. I've got a great question that we can talk about first before the break comes up. We'll talk about medical marijuana a little bit. I have a question here. I am 55 years old. I suffer from fibromyalgia. Can medical marijuana help? How would I get it if it would help?
So medical marijuana is a really interesting topic. It's, of course, quite a heated debate in the state of Florida. I myself was one of the biggest people against medical marijuana myself to start with, and that was really when I was very uninformed about it. Marijuana has been used really since the beginning of time for medicinal purposes, and what that means is it's been used for all sorts of purposes to help people get better. I mean, all throughout history, from the Roman times to the ancient Chinese to really even in our country, it's been used for both people and animals. It was used topically as a poultice, and then people also ingested it and chewed it and ate it, and then also, as we commonly know it, also smoked it. Medical marijuana, or marijuana per se, was legal in the United States really all the way up until Prohibition. And at that time is when it became illegal. It then stayed in that state for quite a long time. It made several resurgences to try to become legal again. But really, unfortunately to say, really big pharmaceutical companies kind of suppressed it quite a bit with the advent of synthetic narcotics. And so it really never gained any traction in the legal form and in traditional medicine. For that reason, most doctors have no experience with it at all, myself included. I had no training in it at all, other than just to kind of know what it was. When we would study any kind of alcohol and drugs at all, we would just maybe spend 15 minutes on it, and that would be about it, and we all either had our opinions or not. Throughout the 70s and 80s and 90s, really, it was just used recreationally, and that's pretty much how it was used. It was not used really for much medicinal purposes. There were some cutting-edge cancer centers that were using it to treat nausea as well as pain, and it was used very well for nausea and helped people who were undergoing chemotherapy to help control their nausea. During this time, though, there was a lot of studies being done on it, and it really wasn't so much just the marijuana per se. It was really the breakdown products within it, of which there are really two. There's CBD, and then there's THC. And there's about 400 active components or active chemicals that are in marijuana, and those are the two most active and two most heavily studied. And that's really where, fast forward, we've come to now is in other states have been a little bit further ahead of us, as well as Europe and other countries, with using both these two components of CBD and THC for medical purposes. So interestingly, symptoms, back to the question, sorry, just giving you a little background, the symptoms of fibromyalgia, CBD, which is one of the products in there, is used primarily for pain, and it is used to great success for muscle spasms, for headaches, for seizures, for people who have Parkinson's disease, as well as anxiety. And it works very well. It's very non-sedating, so it doesn't cause people to become sleepy at all, as opposed to the THC component, which is what everyone is quite familiar with in the marijuana that we all know. And in fact, when the marijuana that is smoked off the street is about 95% THC and really only about 2 or 3% CBD. That's why it was never really used for medical or medicinal purposes, because people did not really get a great pain relief from that, although they did get great success with sleeping as well as anxiety. So for people with fibromyalgia, interestingly, they do have these cannabinoid receptors in their body, which is interesting that people actually have receptors to a substance that we never are exposed to, which is that CBD, and that works and helps control their pain, as well as really, like I said, other sorts of chronic pain, from arthritis, spinal stenosis, cancer, things like that.
Will you talk more about those receptors real quick?
So
for
those
someone-
receptors are all throughout your nervous system, and they are just like opioid receptors, like pain medicine receptors, the ones that we would normally get, traditional pain medicines like narcotics, things like that. And these receptors are there all throughout our body, and they were discovered to be there. And they, when given this CBD, those receptors are stimulated and cause that same kind of response. Interestingly, it does not cause the same response as narcotics do. So there is no there tends not to be any nausea. There tends not to be as much sleepiness and things like that, constipation, none of that. As well as there are none of these receptors in the respiratory centers of the brain, which is where narcotics, we all hear about narcotic overdoses and people dying from too much narcotics, and that's really what happens. There's a center in your brain that has narcotic receptors, and that's the respiratory center. And when that center is overwhelmed or has too much stimulation, people's breathing slows down quite a bit, and then it finally goes to a point where they stop breathing completely. And that's really what the narcotic overdose is. There are none of those receptors, interestingly, for CBD in that area. So there is essentially no way of overdosing with that. So that's one of the interesting things that makes it an incredibly safe medication. Typically, the greatest side effects that someone can have from it is what we would say is somnolence, and just making you sleepy. But there's really no overdosing from it. There's never have been any reported really overdoses from it at all.
So what side effects are there from marijuana? If you can't overdose, there's got to be some other side effects or something.
Well, within the THC component of it, that's the one that causes euphoria, and that's the one that works very well for anxiety, and it works well for sleep. Really, the main side effect from that is if someone were to take too much of it, is most people just fall asleep, and that's pretty much it, fall asleep. The same thing with the CBD. Now, there can be some side effects from the different ways that it's taken. It's delivered in several different ways. One of the ways is as a capsule, just like we get any other medications. The other is in a tincture, which is really a mixture of either the CBD or THC in an oil base that is either applied to your tongue or can be eaten on a small piece of bread. And that one is one where if someone were to, say, drink a whole bottle of that tincture, they may get a stomach ache from that, since it's pretty much oil-based. The third most common way that this medication is used is vaping. And vaping is very similar to an electronic cigarette that we've all seen, except it looks like it, but that's about where its similarities end. Excuse me. There's no nicotine, there's no other substance in it other than the actual oil, whether it be CBD oil or THC oil, and that goes through a mild heating element which vaporizes it, and it becomes almost like a steam, which is really absorbed in your mouth, the back of your throat, and the upper part of your airway. And so there's no real risks with that as well. People who have asthma have used it quite successfully. In fact, it's used to treat some form of asthma as well. So there's not a lot of side effects from that one as well.
And so, would you recommend this for someone with fibromyalgia then?
I would recommend it for people with that. It's not a first-line medication, as it is not for most things. But it's something that I think if people have failed what we consider, reasonable traditional treatment, there's a lot of things that can contribute to fibromyalgia. Many of them are dietary, many of them are, exposure-based and anxiety-based. If those things have all been kind of worked up and treated properly, then I think, and people have not gotten a great success from that, then I think we can move on to exploring that.
All right, when we come back, we'll finish talking more about how you can actually get medical marijuana. Hey, this is Cynthia from Recharge Clinic. Guys, are you ready to feel like you're in your prime again? Dr. Tieche is Ocala's leading medical doctor treating you for hormone replacement, weight loss, vitamin infusions, and more. You can feel confident that you are being treated by an experienced, knowledgeable, caring physician. Come see us, 47 Southwest 17th Street, Ocala, or give us a call, 352-512-9996.
Hi, this is Lauren Gibson from Lauren Gibson State Farm. A lot of people remember to insure their auto and their home, but not their life. If you have someone that relies on your income, you need life insurance. It's as simple as that. Life insurance really should be called love insurance because it's for those that we love. At Lauren Gibson State Farm, our mission is to protect and provide for you and your loved ones. Please visit my website, insuredbylauren.com, or call us at 352-355-3340.
Not only does Triple Crown manufacture trailers, but they also service and repair all makes right at their facility. From boat trailers to enclosed trailers and everything in between. So challenge Triple Crown with your bearing job, rewiring, welding repairs, gate addition, hitch installation, or accessory. They're happy to help you service all trailers at Triple Crown Trailers. Call them today at 352-368-7885. That's 352-368-7885. And speak to their knowledgeable service staff to schedule your next appointment. Or stop by and visit Triple Crown's 2,100 square foot parts showroom at 4251 South Pine Avenue in Ocala. You can count on Triple Crown Trailers for quality service when you need it.
Christian Homeschool Academic Teaching is a 2-day academic and elective program in Ocala. This program is for homeschoolers in 1st through 12th grades. Classes run from September through May. Students may join in the classes at any time. Chat Homeschool Resource Center is located at 1644 Northeast 22nd Avenue, Building C in Ocala. For more information, visit our website at chatocala.squarespace.com or contact Chat Director Vicki List at 352-598-8393. chatocala.squarespace.com.
The GOAT FM. We're Gainesville, Ocala's all talk.
Okay, and we're back. So we're going to finish talking about medical marijuana here. We discussed the background of it, how it helps really on the medical side of it. Talked about someone who has fibromyalgia, it may be helping them. But let's talk about the real question that no one really understands right now is, so now you can get it medically in Florida, but how? How do you get it? People aren't really sure where to get it, how to get it. Can you just walk in the store and get it? The pharmacy? So...
Yeah, that's a good question because it is confusing, and it's confusing to most doctors, and honestly, after still doing it, it's a little bit confusing to me myself. So the state of Florida has approved or legalized medical marijuana for medicinal purposes, not recreational purposes, and they've made that distinction clear. So when they did that, basically they initially gave a list of guidelines of medical conditions that they would allow it to be used for, things like end-stage cancer, rheumatoid arthritis, chronic seizures, glaucoma, and there's a list of about 8 or 9 of them. And then, fortunately, they left a little opening in there for people who have sort of failed traditional medical treatment, who have chronic non-malignant pain or chronic anxiety and things like that. So basically what happens is after someone has most likely failed some other forms of treatment, in other words, they've gone to their doctors, either have had surgeries, and now they're not any better, or are not candidates for surgery, or have tried medicines for whatever their problem is and have not gotten really very good improvement. Then they get evaluated by a physician that is a certifying physician for the state. And once they meet some of those criteria, then we can go on and evaluate them, do a history as well as a physical exam, and see if they're a candidate for it based on that, and discuss it with them. The state of Florida has quite a rigorous protocol for that. So what the process is, they have to be seen, evaluated. We submit all of their data, in other words, all of the medications, their history, the allergies, all of that kind of stuff, physical findings to the state. And then the state then gathers a little bit more information from each patient, and then they process that. When the processing is either approval or denial of that application. And so what happens is it takes about 21 days to really up to 2 months. And then at that point, we get a notification that, let's just say the patient has been approved for it. And at that time, when we can re-see the patient, and then we dose the patient at that point. We give him specific dosages that he can use for his medication. It's very different than using medicine that we are all familiar with, going to a pharmacy. We can't just write a prescription for it at that point and they go to the local pharmacy or CVS and get it. They have to go to what's called a dispensary. And so the dispensary is the medical marijuana's equivalent of a pharmacy. And so they are the only ones in the state of Florida that are allowed to distribute it to these patients. The only patients that are allowed to get it are people that have the marijuana card. So once they come back for their dosing appointment, we discuss the different options, how they would like to try it. Most patients are allowed to try 2 different forms of each thing, CBD and THC, and we go ahead and dose that. They go to the dispensary, of which there are several in Florida, and at the dispensary, then they kind of take it to the next level as far as discussing with the patient which within their options they might want to try. And it really is more than a prescription that we give. It's really more of a recommended dosing, and then the rest is done by the dispensary. The dispensary has really very well trained and very well educated people in medical marijuana, and so they're very sophisticated. I mean, they're very impressive. So they go and they really spend a lot of time with the patients. It's all done privately. It's not done over the counter where 50 people are watching you. Each patient is evaluated and treated in an individual private room, and so no one else knows what's going on, and they get their medications there, and then they start their process. Most of the time, it's not quite so exact, and that's one of the things. As with a lot of medicines, we start out with something, and there's a little bit of experimentation that has to be done as far as finding the proper dose that will help each patient. But we've had very good success with it, and people have done a lot. They've been able to reduce much of their pain medicines. Many people have been able to get off of other stronger medications like gabapentin and Neurontin, as well as anti-anxiety medicines. So it's been very beneficial. Interestingly, I think one of the things that people need to know about medical marijuana, it is not a get-out-of-jail-free card. So if you have a medical marijuana card, you are not allowed to purchase traditional marijuana off the streets and use that in any way, shape, or form. That's still illegal. It's also should be known that marijuana is still federally illegal. So even though it's legal in the state has given everyone a pass here. But the minute you take it to another state that is not, then you run into the risks of being judged by their state's standards.
Is this something that is covered by insurance at all for office visits, or when they go to the dispensary, can they use their insurance to pay for it?
No. This is another unfortunate thing. Since it is still federally illegal, it's a tongue twister, it is not reimbursed by insurance or Medicare. And the VA, which has the largest number of patients that would benefit it, does not recognize this, since it's a federal institution, as a standard form of treatment. So VA hospitals and VA doctors will not even recommend this as a form of treatment to patients. So many of those patients have to seek it out on their own, and frankly will just be discouraged from those physicians. It is not covered, unfortunately, in any way. Office visits, the medications, follow-ups are not covered, and so it is all out of pocket. It is not the cheapest way of getting marijuana by far. I mean, so if someone's just looking for a way to get medications to get high, so to speak, it's not the cheapest way, but it is the safest, it's the most precise, and it's the only way right now that we have as far as being legal.
Okay, good. If you have questions about anything that we just discussed, you can message us on Facebook, email us. We can answer those next week. But we're going to move the topic on to another question that I have. I have a couple questions in this category, actually. One is from a male in his 40s. Says, what type of treatments would you recommend for erectile dysfunction for someone in their 40s?
That's a very broad question. Because there's many, many causes of it. So it's not just this question and then you go, A to B. It's not like an antibiotic type thing.
Is it common for men in their 40s to have erectile dysfunction?
It's very common. So most men experience, about 50% of men have experienced ED or experience ED currently. And that doesn't mean it's every time, but it's very common. Because it's so multifactorial, what that means is there's a lot of causes of it. It's not always just a physical problem. It's many times for men, it can be an emotional problem as well. But there is a sequence and a whole protocol to evaluate someone when someone comes in with that complaint, or any of my patients that already are undergoing treatment and then reveal this to me later, we undergo an evaluation. Really, we want to make sure that they don't have any chronic medical problems that are not treated, such as diabetes, peripheral vascular disease, excessive smoking. And assuming that those are none of the causes, which they are very rarely the main causes of, then we start going to the next level of causes, the most common things. Really, the first thing that we evaluate them for is their general health. People who are extremely overweight, and people who don't exercise or eat properly. That's a very common cause of that. So trying to get them back into shape, get them on a good exercise regimen, and as well as eating properly, because that's one of the main things that can impact on this. Supplements are another one, making sure they're having balanced supplement intake. Then we go to the next thing, which is really hormone evaluation, because that is before you can really prescribe any other treatment, you really have to evaluate their hormone status. And if their hormones are not in balance or their hormones are deficient, then it doesn't matter what else we do, nothing is going to work properly for them. And they need to have that optimized or maximized first, and then go on to the next form of treatment.
How would you look at someone's hormones to evaluate if that was the problem?
Well, the most common thing that is done is a blood test for men and women.
And not saliva? I mean, I know I've heard saliva testosterone
You
tests.
can do it. There's saliva tests, there's blood tests, and they both are okay. I think blood test is what's considered the gold standard. That's the most accurate for this type of hormone. But there are people that do the other ones. I prefer the blood because I feel it's much more accurate. So it's a blood sample. The results come back fairly quickly. It's a very commonly performed test, so it's not something that has to be sent off to a specialty lab. Typically, the results come back within the next day, and so we can evaluate them. Now, it's important to know that when we check someone's hormones, we just don't check testosterone, which is the primary hormone that men have that control this. We really want to check all of their hormones, and that's really what people need to know is when we talk about hormone replacement therapy, HRT, it does not just specifically go to testosterone. We have to look at everything. We have to look at someone's adrenal functions to see their stress levels and how that is playing in there, their thyroid function, and if that's a big role, which has a tremendous role in this as well, and then estrogen levels as well. So we have to look at the whole picture. It's not just simple look at testosterone, treat testosterone, and move on. It's multifactorial, and I think that if you just look at one thing, yeah, some guys will and women will get better, but you're missing the boat for a lot of other ones who need everything else optimized as well.
So let's pick that apart a little bit and go a little deeper. Testosterone is just the main thing that you hear about. You don't really hear about adrenals or thyroid or anything. So let's get to that after. But let's discuss testosterone by itself real quick. So when you get a blood test and you get those results back, it comes as a number. What is the range or the number that men feel they're best at?
So there's ranges for men and there's ranges for women. And it's interesting because depending on who you ask, you'll get a different number. So there's a lab range which was created The labs created all lab reference ranges, and so when everyone gets a lab value, it doesn't matter if it's their blood count, thyroid, chemistries, anything like that, there's a range. And those ranges were created by the labs, long time ago when they started performing these labs, over hundreds of thousands of patients. And really what they took was the low end and the high end, and they said, okay, this is where this low end is the lowest number someone can have, this is the highest number someone can have, and the bulk of them would be in the middle. So if you're somewhere in the middle, and as long as you're not at the outlier on either end, you're what's considered normal. Now, that doesn't mean anything really other than you don't have some severe problem where you're either producing way too much or zero.
But it seems like most physicians will just treat those numbers, though.
It's a very common thing because people don't understand. So hormones are a little bit more tricky or require a little bit more expertise on and understanding, because what they are is it's not just a set number or a range that everyone is going to fall into. They're very patient specific. So within that, a range for thyroid, a range for testosterone, a range for estrogen, even though someone can be within that normal range, that's not the normal, that might not be their normal. They might not to be a little bit higher or a little lower. It's very much like cooking. Some people want a lot more salt in their food, and some people want a lot less. Doesn't mean one is better or one's worse. And if you were to ask someone when you're making that recipe, how much salt do you put in, you'd say, oh, this amount to that amount, and it's really to taste. Well, even though the hormones aren't really to taste, they are to individual preference within the body. And so to look at a range and say that just because someone's in that range, they should be feeling good. Well, by the fact that they've come there and tell you they're not feeling good, you already know that they have a problem. They've told you they don't feel good. So now it's incumbent on you to use your medical skills, which is what we were all taught in medical school, is to do a history, listen to what the patient is saying, and then compare that. Use the labs as a reference to see. It's not the other way around. Treat the labs and then go backwards, which is what happens very much in medicine now. Is because it's an easier way to do it. All your labs are fine, go ahead and go. But really, when you use the labs as what we say is an adjunct, as just some additional information, that's what you're going to get. You know, you're going to get that little bit of help, and then you're going to try and do. People who have these hormonal problems have very specific symptoms, and if you ask the right questions, you will know whether they have too much or too little, and you can then use the labs to adjust it some more and dial that person into the right amount where they will be feeling much better.
So, for someone who may have low testosterone, obviously erectile dysfunction is probably going to be one of those symptoms. What are some other symptoms that shows low testosterone? And can you give us, even though it varies from person to person, can you give us some numbers that maybe someone out there who's listening has had their labs done, knows what their testosterone was, but has no idea if that number really is on the lower range, higher range, or in the middle?
Okay. So for men, if you were to look at a current lab slip or lab result slip, those numbers would be anywhere. It's a very wide range, and when you look at it, you almost have to chuckle because it would say 300 to 900, and that's the range that people would be called normal in. Well, that's a big difference, 300 to 900. So typically, you know, in functional medicine, there have been many, many studies that have been performed, and men typically feel best when their testosterones are over 1,000, really closer to 1,200. And how they came up on that number was they started treating men, and they kept testing them as far as their serum blood level to seeing where they felt the best. And what they did was they tried to get you in the upper 90th percentile of what your lab values or what your numbers would be in your early 20s. And that's sort of our reference guide, is what your number would be between 18 and 25. And that's when men typically, not all, but typically feel their best. They have the best muscle mass, greatest energy level, mental clarity, strongest libido. So our goal is to try and get them back into that range. This number wasn't just pulled out of the air. It was derived that way. So any number that's other than that is going to be less if it's a lower number. So typically most men that I see, their testosterone level is 500 or below. And I see a skewed population. Of course, I see people who are already what we would say symptomatic. So they already have a problem, so they're coming. So, you know, people that feel great are probably not coming to see me. So if someone's got a level of 500 typically, and this is not the case for every patient, so I don't want to say everyone that has a level of 500 feels this way, but most men start to have symptoms. The most common symptom that they have is fatigue. So what they have is mid-afternoon, they are just tired. After, between 3 and 5 o'clock, their battery has run dry. They get home, have dinner, and they plop on the couch. They really don't want to do a lot more after that. Their ambition really starts to drop. Their mental clarity starts to drop. Their drive, the things that kind of drove them to do whatever they do, work hard, have hobbies, any of those things, just start kind of diminishing. They just don't care quite as much. Weight gain becomes another problem because testosterone stimulates your muscles, increases your muscle mass, and so muscles are where we burn most of our calories. And so if the muscle stimulation starts going down, those muscles are not stimulated, the muscle size goes down, we tend to not burn as many calories, and even eating the same amount of calories, we start to gain weight. So that's another problem that happens. So they have the fatigue, they have the mental cloudiness, the mental lack of drive, weight gain, and then one of the things that starts to go next is sex drive, libido. So it doesn't go completely, it's not on off, it's like not one day they have great interest and then no interest. It's a gradual fading down, and this is why it's so insidious for most guys. Is it's a gradual process where it starts to drop at age 30 and starts dropping down. And so what happens is we tend to put it off for something else, saying, you know what, I had a stressful day at work, or I got a lot going on with business, I got a lot of family issues, or I haven't gotten enough sleep. And so, on a day-to-day basis, you can make a lot of excuses of why you feel bad. But when these goes on for weeks and weeks and weeks, and everyone kind of notices you've gotten some differences in how you're behaving, men tend to get grumpier when their testosterone get lower. So these things all start happening, and then after you've gone on vacation and had rest or had a great weekend off, you still don't feel any better. And so these are kind of telltale signs. So I mentioned that number of 500. As the number goes down even lower, which can go all the way down to basically 100 as the lowest I've seen, at 250 is the next big step off point where people start feeling bad. At that point, really, people lose a lot of energy. They really don't want to do a lot. I mean, if they're given the choice, they would rather kind of sleep all day. They will get up and work and do all of that, but they're usually drinking a lot of coffee, maybe a lot of energy drinks as well. Sex drive starts to drop quite a bit at this amount. They're just not that interested as they used to be. And so that starts to be a problem.
Now, the question I had was for ED in their 40s, but is it common for people younger than 40 to have low testosterone or have any of these symptoms?
Absolutely. Interestingly, this problem is becoming more epidemic now, currently, than it was 20 years ago in younger age groups. So traditionally, we had seen testosterone start to drop at the late 20s for guys and early 30s. And then each year it would drop about 5%. But what's happening, it's happening earlier now. And when we compared levels from every age group of both men and women to every age group we did 20 years ago, the levels were dramatically higher then. So there's a lot of things that are influencing it. It's, there are genetics that's involved with it, but unfortunately, it's primarily an environmental problem. It's due to stress. It's due to environmental exposures from products that are in our foods, residuals from plastic water bottles, really all sorts of chemicals and preservatives and stuff that are in our diet have been proven time and time again with many studies that they suppress testosterone levels. And so what's happening is people are trying to do the right thing, eating healthier and exercising, but their levels are still going down, so it's creating this spiral. So we do see it in earlier ages. So we are seeing lots of guys in their early 30s with lower levels, and significantly lower to the point where it's impacting on their lives.
So, what about women? So all of we keep seeing these male clinics popping up everywhere, and we know that men need testosterone. But what about women who are pretty much feeling all of these same symptoms of tired, weight gain, no sex drive? Do they have testosterone? Can they get testosterone? Can they get help as well with all of this?
Yes. So the answer is yes. Interestingly, it's exactly the same for women as it is for men. Now, their numbers are not the same, and they're really, if one were to go to their doctor and ask, a female would ask, what's my normal testosterone level? In this area, when we talked about labs and reference labs, there's even much worse information for females. No one really spent a lot of time trying to gather this information in traditional medicine about what would be normal ranges for women. So these ranges are all over the place. So if anyone even has a drop of testosterone in their body, most likely their doctor is going to tell them they're normal, because they really don't know what to do with that lab value. So because they're afraid of it, they just say you're normal, which is totally not the case. So women really are, just like men have estrogen and testosterone, women have testosterone and estrogen. For women, it tends to be about 1/10 the level of what men are.
Okay. We're going to finish this talk right after the break about women. So listen up, because this is a good one.
Hi, it's Colin Cowherd. Join me each weekday at noon right here on your Florida Sports Talk station.
Hey, this is Cynthia from Recharge Clinic. Come see Dr. Tieche at the clinic to get recharged. Offering testosterone therapy for men and women, vitamin infusions, fat-burning shots, weight loss, and more. 47 Southwest 17th Street, Ocala, Florida. 352-512-9996.
Hi, this is Lauren Gibson from Lauren Gibson State Farm here in Ocala. During this tax season, I would like to remind you to make sure you have properly insured your assets. Do you have enough liability coverage if you were to be sued due to an auto accident? Is your home insured to replacement cost or current value? If you don't know the answers to these questions, let Lauren Gibson State Farm evaluate your coverage. Call us at 352-355-3340.
Document Technologies has been helping Ocala business owners save money on their copiers and printers for more than 7 years. Now they've added the full line of award-winning color copiers and printers from CopyStar. CopyStar has a reputation for their overall low cost of ownership and unmatched reliability. Combine that with Document Technologies' fast local service and 5-year guarantee, you have a combination that can't be beat. Plus, they have special programs for nonprofit organizations and government programs. To find out more about how Document Technologies and CopyStar's award-winning color products can help your business, call Bill Schroeder at 352-368-6664 and start saving today. We use Document Technologies, and so should you. Call 352-368-6664.
And in Gainesville at 372-6666.
Document Technologies, the only copier company you'll ever need.
BJ Trophies, so much more than just trophies. Now offering in-house production of decals, signs, and banners. Let them put your logo or design on almost anything. BJ Trophies also has traditional wedding, baby, and anniversary gifts, plus custom 3D crystal pieces, jewelry, and engraving. BJ Trophies making one-of-a-kind awards for your one-of-a-kind events for over 30 years. Don't forget, BJ Trophies now offers banners and decals for your business. Stop by BJ Trophies on Northeast Jacksonville Road or call them at 732-2249. That's 732-2249 or online at bjtrophies.com.
Hi there, this is Catherine Wendell, and I'd like to invite you to my new talk show, Unknown Encounters, on the GOAT FM. Every Friday from 9 to 10 p.m., we will talk about ghosts, Bigfoot, aliens, angels, healing, and so much more. I'll have exciting guests who have written books and are in the paranormal field. Listeners will be invited to call or text in with their own stories and questions. You can even join us with Facebook Live on the GOAT FM. I've had paranormal experiences all my life and have helped many people. I have also run the Ocala Ghost Walks and historical tours for 9+ years, and I know that people are hungry for knowledge on all things paranormal. I look forward to being able to share unknown encounters each Friday night from 9 to 10 p.m. For those who are not local, you can listen in on the website, thegoatfm.com, or on their Facebook page. It will be aired live, The Goat FM.
Gainesville, Ocala, all time. The GOAT FM.
Okay, I'm Cynthia from Recharge Clinic here with Dr. Tieche with Coffee Talk with Dr. Tieche this morning. You can listen to us every Saturday at from 7 to 8 a.m. We were just discussing hormones and testosterone for men, and we kind of moved it over to women. You hear all about men getting testosterone therapy because their testosterone is low and they're feeling like supermen again with energy and getting their sex drive back. But what about women? Is there something that they can do? Because they're pretty much feeling the same way, but I feel like women are getting a little left out here.
So we had started kind of mentioning levels for women as well. So women's levels are about 1/10 of what men's are. If you were to look into what functional doctors do as far as women's levels, we would treat the same thing. Women feel best probably over 100, closer to 150, which is about 1/10 of what men do. That is nowhere on any of their references for traditional labs. In fact, there's really no mention on traditional labs of what a normal value is for a woman. And again, when we do these studies were all done as the same as were for men. We try to get them back to women who were between 18 and 25 into the upper 90th percentile of what that number would be, and that's where they tend to feel their best. So women have very much the same symptoms as men, maybe even a few more. So the same thing, mental cloudiness, mental fog, that's one thing. They just can't seem to kind of focus as much. Moodiness, unfortunately, is another thing that tends to be a common thing. Yes. With that, and we notice that a little bit. Again, muscle mass, a big problem. Testosterone and muscle mass. So without that stimulation, there's much less muscle mass. So again, weight gain becomes a problem.
But wait, so most women don't want to be muscular. So are they going to be more muscular if they're adding more testosterone?
Yes and no. The answer is yes, they are a little bit, but they're going to get back to the muscle structure that they were probably in their late teens, early 20s.
Okay.
Now, they're not going to get
bodybuilding.
They're not going to get. Now, they can get there if we gave them excessive amounts, but that is not the goal. And it's the same thing is not the goal with men. They are not going to get to bodybuilder levels. Those levels are about 2 to 3 times what are normal levels that we try to treat for both men and women. Now, they're not to say that some women get that, because that's what they want, but that is not the goal. The goal is just to optimize these conditions and help them feel better. So again, it's like about 150 for women, about 12 to 1400 for men is the optimum range where they're not having any of these other side effects, but yet feeling good. The other thing that it helps for women, and this is probably the most important thing. Now, women don't complain of this, but this is probably one of the most important things that I think women need to know about testosterone is the increasing of their bone density. So testosterone is the only thing, and it's certainly the only natural thing that reverses and prevents osteoporosis. The medications that are available for osteoporosis thicken the walls of their bones, but they actually make them more brittle. Testosterone is the only thing that actually increases the marrow of your bone back to when you were younger. So it prevents a lot of bone fractures, which is really a very significant thing for women, because as women are living longer because of blood pressure being controlled and heart disease being controlled and doing well, the next major problem that they have is osteoporosis and bone fractures. Everyone knows about their grandmother or have heard about their grandmother has a hip fracture, and then really that starts the beginning of the end for them, because they're in and out of hospitals and they usually get an infection, and then they go when they were really pretty vibrant prior to that. The other thing that testosterone helps with women is libido too, as sex drive as well. But I mentioned that at the end because it's not really the main reason to do it, but it's a tremendous benefit for both men and women with that.
So you always hear about, or women always hear about their prime. They're going to be in their prime in their 30s, but it seems like the prime is not really there. So testosterone would help that. I mean, as young as in their 30s, they can have testosterone therapy?
Well, unfortunately, women now have the same environmental exposures and stress exposures as men. So what's happened is the studies are the exact same for them. In the late 20s, early 30s, their levels are starting to drop very, very dramatically. So it's the same. Whatever that number is for them, their ideal sweet spot, so to speak, number for that level of where they feel good. Once it drops below them, they gradually start feeling a little worse. And again, it's an insidious thing because many women, and I don't want to stereotype them all, but have begun their families, they have careers at that time in their 30s, so they relay a lot of this other stuff to that. You know, they're very busy with work, they're very busy with their kids, very busy with their homes, businesses, whatever it might be, and so they're tired all the time, have no energy, or putting on weight, don't have any time for their husband or significant other because their energy levels are down, and so it gets pushed off to other things. When yes, those all exist, but in addition to that, they may have an underlying low testosterone level, and so it's something that can be optimized. And yes, we are seeing women in their 20s with low levels.
There's a lot more to talk about, but we don't have a whole lot of time. But let me ask one question. How safe is, since we're just getting to testosterone, we can talk about thyroid next week. How safe is testosterone therapy? Is there a risk of cancer? Or, what are the side effects?
So the risks of all hormone therapy, there was a lot of scares with hormone replacement, particularly testosterone and estrogen. And so the question is, the big broad question is, can these hormones cause cancer? And the answer is yes and no. The synthetic ones, the synthetic testosterones, synthetic estrogens, have all been related to increased risks of cancer, increased risks of blood clots and thrombosis. But the bioidentical ones, the ones that are made to mimic, to be the exact same chemical structure of your body and are absorbed totally different, have all been shown to decrease that. Particularly testosterone. Testosterone is very protective. It's protective. It actually suppresses many forms of cancer, including breast cancer. It actually suppresses it. And so it's actually been somewhat protective. It actually lowers people's cholesterol. It helps with mental clarity, staves off Alzheimer's. As I mentioned, for females, a big thing is the osteoporosis effect and muscle mass effect. So the answer is yes and no. Yes with the synthetics, no with the bioidenticals.
So synthetic and bioidentical, these are both different types of different ways that you can actually get testosterone therapy at your doctor's office. You just need to make sure that you're asking for bioidentical hormones when getting treated for testosterone.
Correct.
Okay. Okay. And so for men and women, they can both. What forms can you get bioidentical testosterone in?
So for women, really there's two ways to get bioidentical hormones. They're either creams, which are applied to your skin and then absorbed, usually once or twice a day, or bioidentical pellets, which are a pellet, which is the concentrated form of the testosterone and or estrogen. It's compressed into a pellet, just like our vitamin tablets are. And those tiny pellets, which are about the size of a grain of rice, are implanted underneath the skin for absorption. And those typically last about 4 months. For men, it's similar, although men also have the additional form of injection therapy, which can work as well. I guess women have the option of having injections, but not as many people choose that. But so men have the topical, which is not used very much, injections, and then as well as the bioidentical pellets.
Okay. And bioidentical pellets for men, if they were to get them, is that something that they do every week or every month?
No, they last typically, for most guys, about 6 months.
Okay.
So they're implanted. They're about, like I said, the size of a grain of rice. The number that are inserted depend on the patient's history, symptoms, lab values, and then they are implanted. They start to work in about 3 to 5 days, and then after about 6 months, they start to fade out and then need to be replaced again.
Okay, so every 6 months, and women's
last about 4 months,
and
3
we're
to
talking
4
about
months.
the pellets, not the
Yes.
creams. The creams are
Correct.
daily.
The creams are daily application.
Okay. All right, I think we'll start. Let's talk a little bit about Recharge Clinic. We're going to close soon, and just talk about your clinic really quick. And you offer these services. What other services that do you offer there?
So Recharge Clinic is a comprehensive kind of wellness type clinic. Basically, we offer other things. Hormone replacement and bioidentical hormones is one of our foundations that we do, but really we really are looking for healthcare optimization and helping people feel better. We also have a wide range of vitamin supplements because we know that people have vitamin deficiencies, so we have either vitamin shots or vitamin infusions, and we can get into that further at another talk, but that's a very good way of getting vitamins. We also have weight loss, because this is very important. Obesity is the #1 epidemic in our country. We also offer injectables, as well as Botox and Dysport, fillers, as well as threading.
Okay, good. So if you've got any questions about anything that we talked about, you can comment on here. We'll take a look at this and we'll answer it next week. We'll be here at 7 a.m. again. And we will take emails all throughout the week, or you can call or text live next Saturday. We'll be talking about, we'll probably start going more into thyroid. These subjects are really big and can take a long time to cover them all, but we're happy to answer questions about anything else. I did have a question about the flu, but we'll get to that next week. And Recharge Clinic is on 17th Street in Ocala, Florida. The phone number there is 352-512-9996. You can call if you did want any kind of consultation to find out more about anything that we just talked about. We would be happy to help you over there. Anything else that you want to add?
No.
All right. Good. Okay. And I'm Cynthia Tieche, and we will see you next week. Thanks for listening.
Hi, this is Lauren Gibson from Lauren Gibson State Farm. Did you know that 70% of Florida drivers are underinsured or not insured at all? In Marion County alone, we had over 90 deaths from car accidents in 2017. At Lauren Gibson State Farm, our mission is to protect and provide for our customers. Please go to my website at insuredbylauren.com or call me today at 352-355-3340.